Most people in the musculoskeletal pain space are chasing the wrong things, patients and clinicians. They're thinking, if I can just get that exact diagnosis, everything will be revealed and make perfect sense. And then I can finally fix it. Or as the patient, if I have that specific exact diagnosis, then I can finally be fixed. But this is not true. And in most cases, searching and waiting for that exact diagnosis is exactly what is keeping you stuck. And let's be clear about something. If we are talking about musculoskeletal conditions, things like back pain, neck pain, shoulder pain, a very specific structural diagnosis does not in any way explain your symptoms very well. It does not predict the outcome that you might have. And in no way does it even change what needs to be done to work towards helping you feel better. And this is a research reality. I'm not just expressing an opinion here. Research on these topics consistently show that people with significant findings on imaging that are leading to that exact diagnosis that everybody wants, things like disc bulges, herniations, degeneration, many times you'll see those anyway with no pain, no loss of function, no compromise to anyone's lifestyle. But at the same time, you could turn around and have somebody come to you with very severe, debilitating pain, and we run them through a scanner of some kind, and they're showing little or no damage to anything. So right away, we have a problem right there. And that problem is that structural issues do not reliably explain the experience of the person. And if the diagnosis that you're seeking isn't going to clearly explain your problem, then making it more specific doesn't help fix that. It just gives the problem a more detailed name, which is likely going to leave you more fearful of what's going on. And this is where things start to go wrong. You go and search for that diagnosis. Now you have this convenient label for your problem. And then that label that you have starts to shape everything that you do, starts to shape how you think about it, starts to shape how you start to move, it starts to shape the things that you avoid. You start hearing it in your head. Your spine's degenerating. Your discs are bulging. Everything is wearing down. And now your brain keeps giving you that little message that there's something wrong with you that needs to be fixed. But this is where it gets uncomfortable and most people don't like to talk about. How your pain is explained to you probably has the biggest effect on the outcome of the situation. When you are given explanations that tend to be structural and damage-based explanations, you tend to move less, you start avoiding more things, you start developing fear around what you can do, and all that will lead to is greater sensitivity, more pain, worse function, deconditioning, detraining, weakness, and worse long-term outcomes. You keep digging a bigger hole. So what you find is this diagnosis you've been seeking isn't going to help you at all. It's just going to reinforce the problem you're having. It's giving you something to blame. And it's giving you a reason to stop doing the exact things that are going to help you improve. And in musculoskeletal pain, outcomes are driven by much more than, in musculoskeletal pain, outcomes are driven by things like your activity levels, your strength and conditioning habits, your overall health, how you believe or what you believe about the pain, your willingness to keep moving, not how specific the diagnosis is. This comes back to responsibility of the individual, which nobody likes to talk about in healthcare. But when somebody says to you, I just need to know exactly what's wrong, what they're really saying is, I want a clear reason for why this is happening. But most of the time, the reason is not in the structure, the reason is in the entire system. And a diagnosis can be useful, maybe. It can help to rule out a very serious problem. It can maybe give us some general direction guidance. But beyond that, it doesn't offer any sort of solution. And chasing more specificity just delays you doing actual work that's going to help you. So you don't need a more detailed explanation of why something is hurting in the musculoskeletal space. And as a clinician, I don't need a more detailed explanation. What we need is to build your capacities back. We need more strength, we need more control, we need more tolerance to loading, we need to reduce sensitivity, we need to change how you think about it. And if all you're going to do is keep chasing that perfect diagnosis, you are just delaying progress you could be making. So we need to start building up your whole body instead. That's how we start to change things. And we're changing them not because we gave you a label. We're changing things because you started to change.